the team at Henry Ford that deals with patients that are having joint replacement. That's all they do all day and every day. So they understand what the steps are preoperatively or before surgery that the patient needs to get through to be successful postoperatively. Postoperatively, we have a very skilled and comprehensive nursing and physical therapy team that keep very close touch with the patient to encourage them through that postoperative protocol. The timing for recovery after hip and knee replacement surgery, it varies between each patient. However, most people are about 50% recovered by about 3 to 4 weeks after the surgery itself. Usually by about 12 weeks, you are 80% as good as you're ever going to be. And then the last lingering bit of recovery comes over the course of about a year.